Good evening. Thank you for joining tonight. We're going to skip formal remarks and just allow more time for questions. But just a quick reminder, please, one question per outlet, a single on-topic follow-up, just to make sure we can get to as many different outlets as possible tonight. And with that, quick remarks from Governor Tim Walz, and then straight to questions.
Yeah, good evening, everyone. Thank you. We know you're pressing up against deadline. I apologize for keeping you late. We just kind of wanted to get this announcement a little bit into prime time and now give you the time to ask anything. So I'm joined by Commissioner Malcolm, Commissioner Grove, and I think Director Kelly may be joining us too. But with that, operator, let's turn it over to questions.
Your first question comes from the line of Erin Hazanze of WCCO. Your line is open.
Hi, Governor. Thanks for taking my question. Realizing the virus makes the timeline in many ways not you. Some restaurant, bars, salon owners just plain and simple cannot make it to June 1st. I know this is a tough decision, but what do you say to the business owners who say they can provide a plan that's just as safe as a retail store? Where is that line, and why continue to keep those businesses closed for a bit longer when they'd be happy to open with more than strict guidelines?
Yeah, well, I think we've seen this everywhere. I think, as you said, with the virus, and as we talked about the time in contact with someone, the distance that you're to them, and the predictability of that, all of those things work against a restaurant, a bar, something like that. But what we've said is that we want to use, much like we did with distance learning, we want to use the next week to provide these, to look at what happens by the 20th of where we're ready to go. And our goal is if it's possible, to be able to start rolling some of those things in. We set the June 1st deadline because the trade groups, many of them said it's going to take us a week or more to get inventory back up, train people, get them ready to go. And so I'm very cognizant of the sense of urgency, but I also recognize, again, if we have to get this right, and I don't disagree. There are going to be those that are ready and maybe some that don't, but I think what we're going to see, because we're moving into that, what we think is still climbing that curve, we're going to have a pretty good idea what happens in the next week of how well Minnesotans are able to buckle down on this. And I think at that point in time, these unpredictable settings will roll more back into them. But I hear them. I know where they're at. This decision allowed us to be prepared for this. And we've got just a little bit longer here, and I think we can do it. But I hear them.
Mm-hmm.
Your next question is from the line of Kent Erdahl from CARE TV. Your line is open.
Governor, you acknowledged it in your call, but how much of this decision was based on the fact that Minnesotans, it looks like, have not been following the social distancing as well as had originally started? I think some data shows just in the last week us falling behind even some states like Georgia that had been opening up. And you're seeing pushback from cities and even businesses that are just saying we're opening, we don't care. How much of your decision is based on that? And then, well, I'll wait to follow up.
Yeah, I would say not much on the opening, we don't care, because it's a message that it's not the way we're going to get this right. I would mention on the social distancing, some did matter on that, because as I said from the very beginning, if people go back and look in March, it was always very clear to me that sustainability of this was going to be a key factor and that there was no possible way. If you look at the data, you're seeing places like LA go till September. They may have it figured out how they're going to be able to do that. I think that is very difficult. So we were looking at some of that data. I do think we dug a little bit deeper, and I maybe could have Commissioner Tomes on here. One of the things that was interesting about this is they were doing proximity to cell phone data in some of that. And one of the things is one of the cities that received the worst grade was Rochester. And it's arguable that there is no place wearing masks and doing this better than the city of Rochester, but because of proximity of cell phones, of healthcare providers, doctors, it was highly concentrated in our third largest city. So I'm not trying to make light of that, because I do agree there's been some of it. But the sense of that I don't care and I'm going to do it on my own, these are not decisions made without healthcare data being involved in this. And the healthcare data shows that we still were not ready to do it. But I will acknowledge that I think giving people something to look to, something to say, let's do it. And as I called out tonight, this is either going to work or not work. And people are either going to stay out of the hospital or get in it, depending on how much people think about why these things make a difference, how they slow the spread of the disease. So Kent, go ahead if you have a follow-up.
Saw the modeling today that showed ending this stay-at-home order versus extending it through the end of the month. And it showed about a difference in maybe 800 or so deaths. And it also showed that we could potentially go beyond our ICU capacity in those couple of weeks. Can you tell us about how that led or factored into this decision?
Yeah, and there's a confidence interval on all of that data. And as we said before, modeling is one data point for us. The updated model does show that. We have certainly pushed out, flattened that curve some. We believe that at peak of this, we come into the middle. Certainly, you're right. To take this further would lower it. Actually, the best numbers were if we did the shelter at home till September. The issue then becomes of weighing the cost of doing that, both the cost financially and the cost to, I have to tell you, the statistics around childhood vaccinations. All of those things as we started to roll back into elective surgeries. So I will be just candid. These are judgment decisions, complex ones, and pretty hard at times. It was my belief, and I think maybe going back to the earlier question, it's going to be dependent on how well Minnesotans are able to continue to do this. So we did base it on that. We do think that there's other factors. One of the things that would certainly change that modeling, the biggest thing that changes that modeling, if Minnesotans say, hey, we've got a lot of stuff back open, we can do a lot of things, we really need to protect folks, let's really buckle down and do this mask and social distancing, that will change that number to a positive. So that was a calculus that went into this decision.
Your next question is from the line of Chris Larson from Flag Family Media. Your line is open.
Thank you, and thank you, Governor Walz, for doing this. Governor, our listeners are in western Minnesota. They wonder why you can't, in the state of Minnesota, have two policies, one for the metro and one for rural areas. Daily on our talk shows, we hear stories of families that can't see loved ones in nursing homes despite being in counties with little or no cases. And we hear from businesses that have lost most of their revenue despite having some of the nation's lowest percentages. They ask, why are you treating the Twin Cities the same as you do rural Minnesota? What do you say to that, Governor?
Well, two of my three highest counties are now Stearns and Nobles, greater Minnesota counties. What I would say to this is, when they say they have none, little or no, that's tested. What we know about this virus is there's a very significant number of asymptomatic carriers. And again, if it gets into a nursing home in Minneapolis, what we've seen is it has a very high fatality rate, but this is in an area where we have literally thousands of the ventilators. In many of the rural counties, they do not have that. But I'll have to be just candid. We are really looking at this, and other states are now looking and learning from this. Can we do regional? And I do understand the logic that goes behind this, but I also want to let people know we went from 0 cases to over 1,400 in a county of 20,000 people in a little over a week. So this is how fast it happens. And this whole exercise is to make sure that you do not overwhelm a healthcare system where it becomes a cascading effect of not just COVID patients, but other people who need care. So I hear them by saying this, but the idea that this is a Twin Cities issue, it is right now ravaging rural areas almost as much as anywhere else. It is certainly a byproduct of density, but once this thing gets out there, it can wreak havoc. And we do have now a system where we can make sure we move people into ventilators, but you just simply don't want to have a run. So I hear them. We're looking at it that way. It simply have to look at the health data on this, and it just did not make sense to say, well, this county doesn't have any. We do know they have it. We just haven't tested it. So hopefully, though, they're exactly right on this. With testing capacity going up and counties that don't have a real high burn rate, that's exactly the situation we want to be in, and they're exactly right. They should be able to go back doing many of the things that they've done before, and if we start to see cases, we go in, we test, we trace, we isolate, and everybody else goes about their business. If we would have been where we are today in March, the trajectory of this would be much different. So I hear them, but that's the reason why that we're just super nervous about the hospital capacity because it is so limited.
Your next question is from the line of Matt Sepik of Minnesota Public Radio News. Your line is open.
Hi, Governor. We have a lot of questions coming about your executive orders and what they mean for youth sports and summer camps this year. Can you talk about that a little bit? What will be allowed, what won't?
Yeah, I sure can, Matt. Those are going to fall under, and I think when people get a chance to look at this, and we'll, I think, over the next day or so, kind of unpack everything that's in here. The DNR is continuing to look in our healthcare, working with them and working with these youth sports groups to see if there are ways, much like we're doing with these other things, are there ways to social distance and then do mitigate the risk and then take a calculated, a calculated movement where we don't think the risk is so great to spread, but we get the benefit, the social benefit, the economic benefit. And so that is happening right now. In this order, it does allow remote camping. You know, I know people talked about that, so we start to think boundary waters, those types of things. And then we're now looking with those experts. And I have to tell you, some of them have put together some really great plans, showed us how they might be able to, to get youth tennis camp going. And so that is ongoing. And I think much like we've done many of these things, we've turned the dial, and then during that time, we've used it to try and work with groups, work with the health department to put out plans to do more. We've learned a lot. We've learned a lot of what went wrong in certain processing plants, and we've learned a lot that went right in some of these manufacturing plants, and the same thing will be true there. So my hope is, and I understand that that is coming very quickly, is to try over the next, between now and June 1st, to get some real guidance of what's possible and what's not. And I think, again, this dang thing is so fluid. I think a lot of us up until probably a week ago kept looking at this idea that children don't seem very susceptible. Once we have more testing, we can see if they're asymptomatic carriers. But now all of a sudden we have a hot spot of what appears to resemble Kawasaki disease or some of the things that are happening in New York. And all of those are playing into our decision. So it's a day-to-day type of thing. Jan, I don't know if you want to speak to how we think about that or what happens when you start making your decisions around things like youth sports.
Well, thank you, Governor. And I think you said it very well. What we're looking at here is, as the Governor has been careful to say, kind of gradual reopening, prioritizing things where people can minimize close contact over a duration of time in a fairly predictable environment where kind of what the interactions are going to be like and who's coming in and how they're behaving in a setting. And some of the things we're most eager to get back to, as the Governor says, are some of the things that are the least predictable by their very nature of who's involved and what comes along with that activity. So we are very much looking for more data on kids and their role in transmission, but also their susceptibility to disease. Luckily, this new disorder that's being reported seems to be very rare as far as we can tell, but still needs to be closely monitored so that we know what we might be looking at.
And just to follow up, in terms of schools, will there be in-person programming, summer school this year, and meal deliveries and child care for essential personnel through the summer?
Yes, and that's where we're finalizing that. The team over at MDE has done a good job with that. We're certainly figuring out the child care because that has been so successful and critical, and certainly the meals is something we're not going to leave these kids out. And we are looking at what a hybrid looks like. And I just, candidly, of being an educator, you're not going to replace that interaction. But there's certain students, because of their needs, that it's really important. And we're trying to figure out how we social distance that, how we bring some of them back. And again, start looking to the fall. I mean, someone asked if what's going to happen in the fall. That to me seems like 2 lifetimes away. We have to start planning for it, but again, every day is a little different. But I think the answer is yes on the meals, yes on the child care, and certainly I think we're looking at some type of hybrid, especially for those students with the greatest needs.
Okay, thank you, Governor and Commissioner.
Your next question is from the line of Brianna Biersbach of Star Tribune. Your line is open.
Hey, Governor. Certainly a lot of businesses and people are going to be happy about this decision, but others are saying it's too soon, including the Minnesota Nurses Association, who said that hospitals are still dangerously rationing PPE. How do you respond to them?
Yeah, well, this is the line we walk, and I think I stressed in my address tonight that we can't allow that to happen. And there are triggers in there, and I listen to the nurses, we listen to folks on the ground, we listen to those procurement folks at the hospitals, and the state of Minnesota now has what, let's just be candid, the federal government should have had in a strategic national reserve. We have a strategic state reserve that we are continuing to plus up. So as some of these come on, and as we measure the risks of what will happen, Commissioner Malcolm can talk about this, and we're taking this a little bit different. The White House put out what basically have turned out to be meaningless CDC guidelines on gating criteria, because the minute they put them out, the president said ignore them, and states started to do that. We took a look at some of those, and they do make a lot of sense, but we also took a look at what fits our situation. And what we looked at is if we're able to permit these things with a turn down of the dial if we hit certain numbers in there, and one of those is the PPE. So I just want to be clear, I do not dispute the nurses who are deeply concerned that we're on the edge on this. We are talking to individual hospitals, and it tends to be, not all hospitals are created equal. And I hear this. Again, I acknowledge the safest way to go would be to continue to ratchet this down. One of the things that, of course, is the economic impact. But as the question that Kent asked earlier, this has to be a very committed social compact with one another. And I think people, what they saw as a rebellion against a government order, I hope now they're seeing as a very compassionate and smart public health decision to make. But I can assure them and assure Minnesotans that if we hit some of those gates that show that we're turning from green and yellow to getting to orange to red, we're going to turn it down. So, Jan, maybe I'd have you talk a little bit about, and I know we'll get more information on your criteria that need to be met.
Sure. Thank you, Governor. And on the governor's web page, on the COVID dashboard, you see every day measures of how much critical care capacity we have and how much PPE. So there are those measures that are very transparent. In addition to those measures that we've been watching and reporting, we're also going to take a really close look at a few things that I talk about periodically on the daily calls, but things like the case doubling time. How many days does it take to double the number of new cases to emerge? And on that measure, we've been feeling pretty good, but we know if our cases start to double within an average rate of 5 days or faster over a 2-week period of time, that will be a real signal that the pace of the epidemic is starting to grow much faster than we would be comfortable being able to ramp up our intensive care capacity. The governor's talked a lot about the importance of testing. So one of the critical measures will be if our testing capacity remains robust, and that we're using that testing capacity. And another measure will be testing positivity rates. That's a really good proxy of community spread. As we test more, if the rate of positives stays in a modest range and only increases a little bit, and we would expect it to as we're testing more, that is another indicator that we're on as I think the governor referred to, we're on simmer rather than a fast boil, which is really our goal. So we put a few of these measures out today as some of the things we're going to be watching closely, and we'll, I'm sure, add additional measures with community feedback and as we learn more. But I think the governor's very serious, and he sure knows that I am, that we have to keep our eye on these things and not be afraid to take another look and to move the dial back down if we need to to cool the temperature, so to speak.
Thank you.
Your next question is from the line of Tom Hauser of KSTP-TV. Your line is open.
Thank you. Good evening, Governor. I have to get your reaction to the latest numbers from the U of M and Minnesota Department of Health model. A lot of people look at this model with a certain amount of incredulity. 16,000 to 44,000 deaths over the next 12 months, perhaps as many as 2,000 by the end of May. I realize those are the upper ends, but people look at that and then they compare them to other models and they just don't see that. Yet you're opening slowly different parts of the Minnesota business community. I'm wondering how much of a factor does that play? If we actually were going to have tens of thousands of people dead, would you be reopening anything?
Yeah, no, thank you for the question, Tom. And again, I would go back to the predictive nature, kind of the directional nature of testing and modeling. And what we know is that as this thing progresses, the numbers you put into the model get the things out that you want to get. And certainly because this was so new, a lot of models changed. The University of Washington model doubled, and it sounds like it's doubling again. But we do look at it. But I think one of the things that we have come to a very just a realization on it is the biggest factor that we can have is the social distancing and the smart strategies that people do. And they're going to have to do those on their own. What we did was, and we asked people to do this, we needed to build a capacity to assume that they might get there. The thing that I know, and I think the path that we're on when we see in real life, I said this a few weeks ago, and if you look, I think I'm going to be right. I think I told you on the 26th of May we would cross 1,000 deaths. That was not a model that they did. That was what we were seeing in real life, but they had predicted the similar curve. And one of the things I think early on that people need to recognize, as I said, and it was met, by even those in the legislature, that it was, outrageously wrong when I said between 60 and 80% of us will end up getting this over the next 18 months. Well, that's how these diseases work. That is what's going to happen. And given the situation we were in with healthcare capacity and all that, that will impact those numbers. I think what people need to know about these models is they give us a pretty good indicator of where things are going, but we can adjust the outcome of them by our behaviors and the things that we do. So it plays into it, but it's one thing. But there's also, as I keep saying, there's a social psychological factor of how long people can do this. And I just, from a human nature standpoint, I knew clear back in March that it would be impossible. And that model today, if I were going to go the very safest route according to the model, that would be September. But I would argue there's another side of the ledger that we would have not just economic issues sheltering in place at 80% till September. We would have serious health issues on that. So it plays a role in it. I think we're refining and learning more from it, but it certainly predicts that curve. And Jan had some slides, I don't know if she went over it with you, that kind of overlap relatively close, but they're not exact. So I think that argument that all models are wrong, some are less wrong, and some are useful. And we think that the University of Minnesota model is useful in our situation of predicting where we go. But the earlier question was right. If you looked at it just like that, what they said was, and this weighs heavily on me, Governor, by moving this, even the model shows you might lose 800 more lives. And those are those are all Minnesotans. That is the potential if we don't get it right.
From a consumer level, just as a follow-up to that, given what these models show, what is the likelihood you are anytime soon going to allow shopping malls to open and health clubs and even bars and restaurants? I know you're targeting kind of June 1st, but what's the reality like? And what numbers are you going to be looking for in the next week or so to make that call?
Yeah, and those are some of Jan's numbers that she talked about it. But what's happening with hospitalizations if it stays steady? Because the fact is, what we ask people to do, and this is true, this is pretty horrific for people with underlying conditions and elderly. They got to stay out of the path of this. But it is true that most people will just get either milder cases that they'll get over, and the 15% who need help, as long as there's rooms, they'll get pretty good care. And it's still scary because there's, even with remdesivir and some of these, we still don't have good therapies. But we're looking at them and again, asking of places that can be open and do this. I'm just going to be looking at if Minnesotans are keeping their social distancing, if they're able to. Malls will be open. We're going to have to deal with the common areas, but these are retail stores. We certainly don't want people hanging out in the food court and doing things, but those are retail places. And I think what we're going to be tracking is number of positive cases, number of hospitalizations, certainly the deaths, and to see if what we've done has shifted that. Because I have to tell you, Tom, I think at some point in time, the cost-benefit analysis of locking down, how many more masks could I get during that time? How many more ICU beds could I get during that time? The answer to those questions is not all that much for the cost of what the lockdown is, and then you have to weigh it about how many people do you think will get sick because of this. And I'll keep coming back to this. Everything that we've done will not have as big of impact if people choose to wear masks. And I mean, again, I'm telling people, not wearing a mask is not a sign of rebellion. It's just hurting your neighbor. And so I get it that people are frustrated with the shutdown, but the way to protest that is just to yell at me or do whatever, but not wearing the mask makes it worse. So we're going to move. The malls are open. I think restaurants, there's the potential there to look at that, and we're learning from other states. I mean, there is something to be said about these other states pushed out pretty fast on some of their people. We hope that they get good results, but we'll learn one way or another.
So just to make sure I understand this correctly, so the malls under your orders tonight will be allowed to open, the retail stores in them under the regulations that you've set forth. Okay. Thank you,
That's
Governor.
correct. And we just have to work with them on that common space.
Your next question is from the line of Theo Keith of Fox 9. Your line is open.
Governor, just a couple quick hitters here from viewers and people emailing. First of all, how about driving schools?
You know what? I don't personally know that one right now. That is a great question of how we get those licenses. I'll tell you, I'm getting a lot of letters from 16-year-olds, and man, I'm sympathetic. Is anybody on the line, or can we follow up with Theo on that one?
Theo, this
Theo,
is Teddy.
Yeah. Governor, this is Steve Grove over at DEED, and guided instructional activities are allowed. It's allowed to just fishing, birding, and outdoor fitness training. So that is included in the, you can see it in Section 8 of the executive order.
Okay, thank you. Go ahead, Theo.
And then just more broadly, I mean, the number of emails that I've gotten just since you announced at 6 o'clock is incredible. People wanting different industries, wondering if different industries are open. Who are they supposed to call?
Yeah, it's a great question. And this is the thing that, you know, when we talked about this, and the people are not wrong thinking about geographic differences, but the more complexity you add, the more confusion you add. So I'm going to have Steve Grove maybe talk on this.
Yeah, you bet, Governor. Hi, Theo. It's a good question. So we have just updated mn.gov/deed/safe-work with all of the details on what's open, what's not, and what's required for businesses to re-enter the workforce and the workplace here. That includes both the templates for safety plans, the guidance on 50% occupancy for retail, and importantly, information for workers on how to stay safe as they go back, because we know workers going back into the workplace want to be sure that they're safe too. And so we have a lot of guidance there as well. So lots of FAQs, lots of detailed guidance. mn.gov/deed/safe-work is the place to go. And if you have questions, I should add, because you mentioned that, there's an online form where, based on the type of business that you are or the question that you have, we have experts at the ready to respond very quickly to incoming that will come in for clarifications.
Operator, we have time for just one more question this evening.
Next question is from the line of Jesse Slater of KBJR6. Your line is open.
Yes, hi, Governor. We've had viewers asking us since this announcement, when you talk about retail businesses being able to open at 50% capacity, what does 50% capacity look like to these businesses?
Yeah, I'm gonna let Steve have this, because this is always really tough, and I think it's to try and get the social distancing. One of the things we looked at, I saw, Wisconsin did the 5 people per store. Well, stores have very different sizes. So, Steve, do you want to talk about how they do that on capacity?
Sure, Governor, and it is a great question. I think we've been studying plans across the country and how, in terms of how different states have handled this, and really, in a majority of cases, in fact, of almost all cases in which occupancy limits are used, that 50% number makes sense for retail, and it just has to do with traffic patterns. It's a mental model. I'm not sure if every store is going to have somebody standing out there with a clicker. Each store is going to, handle this in the way that makes sense for them, but it's about just reducing the number of people in a store to limit the number of incidental contacts and allow people to remain 6 feet apart. And this is very consistent with guidance that we got from the Minnesota Retailers Association, who we've done several meetings with, along with a lot of other retail leaders in the state, to figure out what kind of guidance we should have. And I should mention that on that website, mn.gov/deed/safe work, there's a whole really useful 3-page guidance document from the Minnesota Retail Association that addresses that 50% occupancy rate and goes into a whole host of other best practices that they've seen from retailers in critical industries who have been open already, as it relates to, clear shields at the checkout, floor markings, signage, what have you. So there's a whole new industry around how to get social distancing right in the workplace, and we're lucky in Minnesota to have so many business leaders who've encapsulated that for us in a guide that will help new businesses who are now coming back into the market.
And just one really quick clarification. Can you clarify if fitness centers are now going to be open under this?
They are not, but the governor has instructed his cabinet, myself, Commissioner Malcolm, Commissioner Lepping, and a whole host of others to begin to make plans for those places of public amusement. So that's guidance you will see coming in the next week, with a target of June 1st to phase in those settings. So gyms are not open Monday, but are part of that next tranche on June 1st that we're going to begin to provide guidance for very shortly.
Thank you.
Well, first of all, thank you, everyone. Again, I know you ran late, and I would just say on all this, Minnesotans will go back to retail and back to some of these activities when they feel the confidence in them, meaning that they're safe, that they're not overcrowded. And I also want to note that we had two really important other executive orders today. One dealing with the most vulnerable and homeless and others, to make sure that no one falls through the cracks as we do this. And the other one was on worker protection. I think both of these are probably nation leading, because we understand there's going to be situations where workers are going to say, I don't believe my store is safe. I don't believe that things are being followed. We want to make sure that they do that. And I understand the vast majority of employers are open and want to hear that because it's best practice. We just want to make sure there's no retaliation against that, because the way we whip this is people to say, hey, boss, I really don't think we should have 6 people in that aisle. And what we could do is we could put dots on the floor and say no more than 1 in an aisle and go through. Those are the types of things that are already happening, but we want workers to know that they can rest assured that they're not going to be retaliated against, and there's a process. So we need to restore confidence. Again, we can do what we can do. We ask Minnesotans to give us time to build up, to build testing, to come up with a strategy, to learn. We've done a lot of that. We're not telling everybody to go back to normal. We don't want to see them flock into the beaches altogether. But I think if Minnesotans take the ownership of this, and I keep hearing people talk about that, if they take the personal responsibility to say, hey, it's not going to be normal like it was before, but this is a sustainable normal. What we're asking here, we might actually be able to get by for a few months until we get really good therapeutics, or, luckily when we finally get that vaccine, then we can start doing that. So we'll follow up more. I know there's going to be a lot of questions. I want to thank all of you for trying to clarify this and put out information. We're trying to be as clear as possible, but I think, as many of you said, you're getting a ton of questions because for every rule, there's 1,000 exceptions. We want to be clear on that. So we'll talk more tomorrow. Thanks, everyone.
Find more local news stories at ccxmedia.org and follow us on social media.